When you're studying pediatrics, it's so easy to get completely lost in the diagnoses, the pharmacology, the pure science of it all. But what really makes a great pediatrician? Well, it goes deeper than just clinical skill. It's about playing two roles at once. Being a medical expert, sure, but also being a fierce guardian for a child's total well-being. Today, we're going to dig into the very heart of what we do. So let's just start with the most basic question there is. When a child is in your care, what is your absolute number one first duty? Is it just to cure whatever illness they have? Is it to comfort the family? Or is it something bigger? And here it is. Your first duty is to be both a healer and an advocate. This is really the core idea of modern pediatrics. Healing, that's the science, right? The diagnoses, the treatment plans. But advocacy, that's the ethical heart of our job. It means making sure that child's rights are protected, that their voice gets heard, and that their best interests are always, always put first. The two things can't be separated. Okay, so to really understand what it means to be an advocate, we have to start at the very foundation of our clinical practice. And I'm not just talking about philosophy here. This is a real legal and ethical framework that should guide every single decision we make. This right here is the United Nations Convention on the Rights of the Child, the UNCRC, which India adopted way back in 1992. Now, what this document does is it takes these big, abstract ideas about rights and turns them into concrete obligations for us in the clinic. For example, it talks about the right to the highest possible standard of health, that's our direct job, and it demands protection from all forms of violence and abuse. So this isn't just for lawyers, it's basically a pediatrician's code of conduct. So now that we have that foundation of rights, we have to face the really tough part, the grim reality of what happens when those rights are violated. This is where our role as an advocate becomes absolutely critical. And honestly, it's often the hardest part of the job. We have to be ready to see the things that other people might just miss. The World Health Organization gives us this really clear, comprehensive definition. But I want you to focus on two words here: potential harm. That's so crucial. It means we don't have to wait for a serious injury to happen. Our responsibility kicks in the second we suspect a risk to that child's health, their survival, their development, or even just their dignity. It's a huge and very serious responsibility. So what do you do when you suspect abuse? The first thing is you don't panic. You need a system, and this is the protocol. Step 1. Always ABCs. Are there any life-threatening conditions? Be a doctor first. Stabilize the child. Once that's done, you move on to a really careful and meticulous history and examination. Then comes the critical part, documenting and reporting. Your notes have to be thorough and completely objective. They are the foundation for everything the authorities will do. And finally, you have to make sure that child is going to be safe. The systematic approach turns a really chaotic and scary situation into a manageable clinical pathway. All right, so if protecting a child's rights is the why we do what we do, then we need a powerful tool for the how. How do we systematically make sure a child's right to health is being met, especially at the primary care level? Well, the answer is the Integrated Management of Neonatal and Childhood Illness Strategy, or as we all know it, IMCI. So IMCI is this globally recognized evidence-based strategy that was put together by the WHO and UNICEF. The goal is incredibly simple and incredibly powerful: reduce death and illness in children under the age of 5. It's built to be a practical, effective tool for every single healthcare worker at that first point of contact. The absolute genius of IMNCI is how simple and structured it is. It basically boils down the entire process of managing a sick child into 3 clear sequential steps. Let's break down how this works.
This flowchart pretty much shows you the entire logic of IMCNC. You start right at the top. A sick child comes in. First, you assess for specific signs. Based on what you find, you classify the illness based on its severity. And that classification, it points you directly to a specific plan to treat the child and counsel the family. It's like a roadmap that takes all the guesswork out of managing common childhood illnesses.
Now, this color-coding system is the absolute heart of the classification step. It's simple, it's elegant, and it saves lives. Pink means severe disease. This is an emergency, and it requires urgent referral to a hospital. Yellow means moderate disease, something you can manage with specific treatment right there in your clinic. And green is for mild disease that just needs some simple home care advice. This system lets you triage kids in seconds and make sure the sickest ones get care first. Before you even start thinking about a diagnosis like pneumonia or diarrhea, you have to check for these general danger signs. Ask the mother, Can the child drink or breastfeed? Are they vomiting everything? Have they had convulsions? And look at the child. Are they lethargic or unconscious? Now, here's the most important point. If even one of these signs is present, the child is automatically in the pink category. This is your non-negotiable first step. Okay, we've got the theory down. Now let's see how this standardized approach actually works in practice across a couple of different common conditions. You're going to see the same elegant logic pop up again and again, which is what makes this system so easy to learn and use.
So just look at these two charts side by side. On the left, we're assessing for cough or difficult breathing. Signs like chest indrawing or stridor, that leads to a pink classification of severe pneumonia. Now look at the right. We're assessing for diarrhea. Signs like lethargy or sunken eyes, that leads to a pink classification of severe dehydration. The diseases are totally different, but the process, assess, classify, and treat is exactly the same. This is pattern recognition at its absolute best, and it's what makes IMNCI so powerful.
And that really brings us full circle, right back to where we started. Great pediatric care, it lives right here, at this powerful intersection. The IMNCI strategy gives us the clinical tools we need to be effective healers. But our understanding of a child's fundamental rights, that's what gives us the ethical responsibility to be their advocates. So the question I'll leave you with is this. How are you going to integrate both of these into every single patient you see?